Good afternoon, everyone. Gareth Presch, founder, CEO, World Health Innovation Summit. Delighted to welcome you to our short discussion today. We're going to talk about the World Health Innovation Day. We're on to our second year. Mark your calendar, 2nd of August 2025. Delighted to welcome Lameck Oyoo, who is in Kenya. Lameck has been pioneering the World Health Innovation Day in Kenya, in Africa. Lameck, you're very welcome. Let me just set the scene for everyone who's tuning in. So, World Health Innovation Day, what is it? What's it about? It's an annual celebration of people, organizations, communities who make health innovation happen. Lameck's one of those individuals on the ground, doing it day in, day out, particularly with vulnerable patients, cancer patients, supporting families. World Health Innovation Day is our second event. So this is the global event, and we want to inspire local and national organizations, medical professionals, academics, and students to take part in this health and well-being activities around the world. It's very simple. The goals are to give people the tools to manage their own health and well-being by 2030 and build a global community reaching over 1 billion. That's the target. It's an ambitious one, but it's one I believe we can achieve. Lameck, you put on a series of events last year in Kenya, football tournament. Like, just explain to people who've listened in, firstly, how did you get involved? And then secondly, what did you do? And then what was the community's feedback?
Yeah, thank you so much, Gareth. Sorry for that. I know it's been have issues of network, but I'm getting you very clear. Thank you so much. My name is Lameck Oyoo. I'm the director AFIA for Africa. It's an organization registered here in Kenya, and we are working towards 4 thematic areas, and that is education, gender, climate change, and health. In health, we basically focus on non-communicable diseases, and we create awareness on cancer, work closely with cancer patients, caregivers, and also practitioners. In education, we work with students and learners in both primary and secondary schools, especially on mental health and also education supplies. Just to come into our discussion today, World Health Innovation Day. Last year, we really had a very successful event that we had organized at the community level. And this event, we brought together football teams, around 4 football teams that we brought together. And these 4 football teams, we had a trophy. And this trophy, they were to they were to play together, and then we gave the winner. The reason why we were doing this is because with the World Health Innovation Day or World Health Innovation, the mission is to bring community together and also celebrate and also work on their own issues. So last year we were looking at mental health among the youths, and the only way we can also bring the youths together is through the sports, and that is why we ventured into football games. Yes.
Yeah, fantastic work, Lameck. I mean, you've been pioneering this stuff, particularly at the grassroots level, and I think it's very important to be able to reach out to local communities to actually engage with them, build that trust. Have you got any feedback from last year's event? I mean, you had how many? You had about eight local teams, was it, football teams that you organized, and also like share with those who are listening, like, how did you just decide, right, I want to do this and I'm going to do this as an organization? Because you really did pull this all together yourself. I mean, you deserve a lot of credit.
Yeah, thank you so much, Gareth. And when you are passionate about something, you have to go for it. It's not like a way to be pushed to do something. So I'm really passionate about health, and I'm really passionate about community outreach. So that is why I had to organize my team, and also we came together and do the event last year. The feedback was very immense and really encouraging, because when we were there, one thing I came to realize that we only worked with men, but this year I'm really anticipating and looking forward also to bring women, because women are also playing football. So since we started with the football match, I don't want to drop it down. I don't want to drop it down. I want to escalate it, because we were having 4 teams, and this time anticipating to have like 16, either 16 or 8 for women and 8 for men, so that also women can be brought in, because when I look at the cancer, state in Kenya, women are more hit with cancer than men. So both breast and cervical cancer. And through sports, it's a way of also reaching out to the community and also creating awareness. So there was a very good feedback from those who participated, and also that is why they came also with an idea of involving women. Yes.
Yes, brilliant. So look, the plan for this year, what's your plan for this year?
Yeah, this year looking at bringing together more teams to participate, and also to involve other activities, and also to involve local media stations like local radio stations and also local TV stations, so that as when we shall be celebrating, so the World Health Innovation Day this year should have a route whereby people get to know what is going on, and the only way that people needs to get to know what is going on is by using the media stations and also community, especially the community policymakers. Which last year I tried to reach out to the county government officials of Kisumu officials, the CEC of Health Kisumu County. We had a discussion, but he did not get time to join. So this time I would want to bring together and also reach out also to the county government, so that they can also come in and celebrate this day. Yes. So this year I'm looking for a very big event, and also to make World Health Innovation Day get known in Kenya, whereby several different communities can also have events on the same day.
Yeah, and it's brilliant, and it's a great way to mobilize communities, through health and well-being activities. And also, I guess your plan then will be to do Kenya, but then also you can spread the word across Africa.
Yeah, very true. Yeah, that is very true, because we have a small network of friends from Cameroon, from Congo, from Malawi, and from Uganda and Tanzania. So we'll try to reach out to them if they can also have an activity on that day, so that it gets spread all over Africa. Yes.
Fantastic. And hopefully somebody, the diaspora who are watching this, can reach out and support you as well. I think that's one of the things with the World Health Innovation Day. It's really about community, and allowing people to take that ownership, create an event, create an activity that is local, but then becomes a way for people to, share knowledge, work with health professionals, work with different agencies, be able to promote health and well-being. So that's really what we want to try and create, is that community spirit worldwide. And we definitely need it in these challenging times. I think health can be that great bridge between, various factors. It's apolitical. We can just focus on, improving people's health and well-being. Of course, that has economic growth opportunities as well. So I see this as a great opportunity for us to share wisdom, but also share knowledge, exchange resources as well, and look as well for opportunities, investment opportunities as well. I think we've kind of covered most of it. Is there any final message that you'd like to say, Lameck?
Yeah, because it's an event that this will be our second event, and also the second World Health Innovation Day. So we are calling for partners and those who are passionate about community health outreaches, so that they can also join us, especially here in Kenya, and also those who are overseas. They can also join and support us. For example, for instance, as we are going to organize also a football match, we would want to receive football, the soccer balls, trophies, and also for the uniforms for the teams that will be playing. So whoever is willing to come handy and support this, we shall really appreciate. And also, it's not limited to the football match, but it's open to any activity, including the medical camps, so that the community can also benefit out of those medical camps in such like eye screening or cancer screening, and other medical services that can be provided. So whoever is willing to join and support this event, I think it would be very much much more appreciated if we get more partners in it, and then it will have a gravity. Last year we did it alone as Afia for Africa, but this year we are anticipating to have more partners in it, so that we do it with a lot of gravity. Yes.
That's brilliant. Yeah, and just to say, you know, like myself and Lameck have been working on how we can build the ecosystem out in Kenya, in Kisumu, how we can support. You know, there's a lot of work that needs to be done. Africa needs a lot of help and support, but also like locally as well, we have to build that trust with the community, particularly in the health sector as well. This is a great opportunity to do that. Those who are interested can reach out and support, like through myself or Lameck. You know, we have plans, we have big plans. We want to provide clinics, you know, we want to provide those screening services. We want to do quite a lot. We'll age while we'll do this, but we'll age gracefully, shall we say. Lameck is dedicated. He's done fantastic work on the ground. I'm very much looking forward to supporting and getting involved. So, look, for myself and Lameck, this is just a short update. Keep the date in mind, 2nd of August. Check out the website, really important, www.wis.world/World Health Innovation Day. We've got a lot of activities. We're trying to spread this around the world. Get involved. There's a form there online. You can join in if you're local community groups. Reach out to Lameck online as well through LinkedIn or through various social media posts. But for myself and Lameck on this Friday afternoon, we wish you the very best. We'll be in touch. We'll be online. And we're very much looking forward to building up and building that momentum towards the 2nd of August. Okay, so for myself and Lameck, we'll say goodbye, and we'll catch up with you soon. Have a great weekend, everyone. Thanks.
Bye. Bye, everyone.